Hello, and welcome to Sekahan. Today we look at why Japan's health ministry scrapped a cancer movie tie-up in just 5 days and how Japan reacted. In August 2026, Japan's health ministry canceled a tie-up with a movie about cancer, just 5 days after announcing it. The posters were headed for the hospitals that cancer patients visit for their treatment. And here lies the problem. Some of the people who most needed the information were also the people who least wanted to see that poster. So what exactly went wrong? Let's separate the message from the delivery. First, the outline. On August 19th, the Ministry of Health, Labor and Welfare, Japan's National Health Authority, announced a tie-up with a film opening in October titled, "Even If Mom Is No Longer in This World." Posters were sent to designated cancer hospitals across Japan, with display planned there. Criticism from patients and medical workers came fast, and on August 24th, 5 days after the announcement, the ministry canceled the campaign and began recalling the posters. The campaign's real goal was not movie promotion. It was to publicize support programs for AYA generation cancer patients. AYA stands for Adolescent and Young Adult, roughly ages 15 to 39. We will come back to this group in detail. 3 questions for today. First, why was this canceled in just 5 days? What exactly was the problem? Second, what was the ministry actually trying to deliver? And third, how can necessary information reach patients without hurting them? Let's start with how this campaign was designed. So how was this campaign designed? The posters combined the film's key visual with a QR code, and that code led to a pamphlet of support programs for young cancer patients. The idea: someone moved by the film scans the code and discovers programs for themselves or someone close to them. Movie and drama tie-ups are not unusual for this ministry, at least 6 in recent years. This was a routine publicity method, not a one-off experiment. Now, the 5 days. Right after the August 19th announcement, criticism poured in from patients, families, and medical workers. The title evokes death for people in the middle of treatment, and a hospital is the last place to face it. A member of parliament who had survived lymphoma said she felt deep discomfort, as a patient herself, at using this title as the entrance to support information. Note her point: not just where the posters would hang, but the choice of words at the entrance itself. On August 24th, the ministry canceled the tie-up, began recalling the posters, and deleted the campaign pages, apologizing for a lack of consideration for patients and their families. The film's production side had not commented publicly as of August 25th. Here is where that title comes from. The film is based on the real story of Nodoka Endo, diagnosed with stage 4 colon cancer at 21, married, gave birth to a daughter, and died in 2021 at 24. The source book is the diary she kept writing for her daughter so the girl could read it after her mother was gone. Even If Mom Is No Longer in This World is, at its origin, a mother's parting words to her child. And choosing this film was not an unreasonable idea. Its heroine faces nearly every issue the pamphlet covers: treatment, work, marriage, childbirth. This video is not a criticism of the film or the family. The question was where those words were about to be displayed. Some background on the AYA generation. AYA stands for Adolescent and Young Adult, the age band from the mid-teens to the late 30s. By a 2017 estimate from Japan's National Cancer Center, about 900 people aged 15 to 19 are diagnosed with cancer each year. In their 20s, about 4,200. In their 30s, about 16,300. Around 20,000 a year in total, roughly 2% of all cancer diagnoses, a small minority. And because they are a minority, they slip through systems built around the typical cancer patient, who is much older. This group faces life problems and treatment at the same time: a new job and little savings, small children, or plans for marriage and childbirth still ahead. What the ministry wanted to deliver was one pamphlet, a guide for people diagnosed with cancer between 15 and their 30s. The QR code led there. It is a cross-cutting map: money, work, school, fertility. For example, Japan's high-cost care program caps what you pay for treatment each month. A sickness allowance covers part of your income while you cannot work, though it applies to salaried employees, not freelancers. Preserving fertility, freezing eggs or sperm before chemotherapy, has subsidy programs, with conditions that vary by prefecture. And cancer consultation support centers, free counters at designated hospitals, covering everything from treatment to money to school. The pamphlet itself was new, compiled in February 2026 under the National Cancer Center's supervision. But a program that exists is not a program that reaches you. A salaried employee gets about 2/3 of their income covered. A freelancer gets nothing equivalent. Subsidies differ by region. And in the confusion, right after a diagnosis, working out where to ask what is genuinely hard. The programs also keep changing. The cost cap rules were revised in August 2026. That is why publicity mattered, and why the goal itself drew little criticism. The film itself looks genuinely good. The puzzle is why the government thought this tie-up was the way to reach patients. That post captures the Japanese reaction. Now for the Japanese reactions. On X, the dominant view was that canceling was the obvious call. What stood out was how carefully people separated the film from the campaign. The criticism aimed at the ministry's judgment, almost never at the movie or the people who made it. The center of gravity was closer to bafflement than anger. Here are 3 representative posts. First, the woman this story is based on chose her child's life over her own treatment. What message was a hospital poster of that choice supposed to send to patients? Second, from a psychiatric nurse. The film looks genuinely good. The puzzle is why the state concluded this tie-up was a sensible way to reach patients. Canceling was the obvious outcome. And third, more bluntly, is this slightly off-target feeling just what official communication looks like? The recurring shape, a good story, put in the wrong room by an institution that did not picture the person standing in front of the wall. So let's do exactly that. Picture the person in front of the wall and unpack what went wrong. The poster Japan's health ministry withdrew in 5 days was bound for the hospitals that cancer patients across Japan visit for treatment. The place where people most need support information is, indeed, the hospital. But among those people were patients in exactly the situation where a title like "Even if Mom is no longer in this world" is hardest to face. Some of the people who most needed the information were also the people who least wanted to see the poster. The campaign was built on that overlap. The problem was not the film and not the publicity goal. It was the place and the words chosen as the entrance, the delivery design. The title of "Even if Mom is no longer in this world" was, in the original book, a mother's parting words to her daughter. A cinema is a place you choose to enter. You brace yourself before facing those words. A hospital is a place you must keep visiting for treatment. For a mother in treatment looking up at that title, it could turn into a sentence about the time after she is gone. Whether the posters actually went up has not been disclosed, but the difference in escape route or none is decisive. And the criticism was not only about location. Using this title as the entrance to support information drew objections in itself. Would a different location have been enough, or was the choice of words the problem from the start? Even among patients, the line falls in different places. A similar stumble happened 7 years earlier at the same ministry, the 2019 Life Talks poster. Life Talks, Jinsei Kaigi in Japanese, is a campaign encouraging people to discuss end-of-life treatment wishes with their families in advance. Its poster featured a comedian on a hospital bed speaking about his own death. After protests from cancer patient groups, the ministry stopped shipping it the day after release, even faster than this time's 5 days. The 2 cases differ in target, purpose, and expression, and whether the causes were the same is unknown. What they share. In both, criticism came from patients about how the message landed on the people already living with the disease. Here is a tool for thinking about this. How governments and experts communicate risk, illness, disaster, to the public is a field of its own, called risk communication. The distinction that matters here is the audience's situation. One kind of messaging aims to turn the heads of people not yet affected. Get screened, have the talk. Strong imagery draws attention. The other kind delivers information to people already affected. There, the same imagery of death and fear can wound. Build the message from the receiver's situation, not the sender's good intentions. With that distinction in the design, a cancer hospital's wall might not have been chosen. And the options were never just cancel or continue. Limit posters to cinemas, where people choose to enter. Make a hospital version with program information only. Show the actual materials before release to patients and clinicians across different situations. Whether any patient review happened this time has not been disclosed, which is why the next question is not the wording of the apology, it is the design of that procedure. Back to the 3 questions. 1. Why canceled in 5 days? The combination of the title and the planned display location drew intense criticism, and the ministry conceded a lack of consideration. 2. What was it trying to deliver? A one-book guide to support programs for young cancer patients, a goal that itself drew little criticism. 3. How to deliver without hurting. Separate head-turning messaging from patient-facing messaging and build pre-release review by patients and clinicians into the process. What the ministry tried to deliver was information that young cancer patients genuinely need. What failed was the delivery. And the posters are gone, but the counters remain. Japan's cancer consultation support centers sit in designated hospitals nationwide, free, anonymous, open to patients of any hospital and to families. If someone close to you is looking for this information, ask how they feel first, then let them know this counter exists. The pamphlet is still published. For the full written analysis, see the article linked in the description. If you found this useful, please like the video and subscribe. Thank you for watching.